Lymphoid progenitors are produced in which of the following tissues? A. The bone marrow. B. The liver. C. Gut-associated lymphoid tissue, GALT. D. All of these. The answer is D. All of these. Lymphoid progenitor cells are produced in all of the following tissues: the liver, the bone marrow, spleen, and gut-associated lymphoid tissue, mainly found in the liver and intestines. However, note that the vast majority of all blood cells are produced in the red bone marrow of long bones by hematopoietic stem cells. Which immune cell is specialized for immunity against multicellular parasites? A. Eosinophils. B. Basophils. C. Monocytes. D. Natural killer cells. The answer is A. Eosinophils. While all of the cells listed may have some indirect involvement in the overall response to a parasitic infection, eosinophils are the only immune cells that are specialized to respond to multicellular parasites, especially helminths such as hookworms and pinworms. Mast cells contain high concentrations of which of the following? A. Tryptase. B. Heparin. C. Histamine. D. All of these. The answer is D. All of these. Mast cells are rich in granules that contain high concentrations of heparin, histamine, and trypsin, among other preformed proteases. These granules also contain serotonin and various eicosanoids. The function of mast cells is primarily to regulate immune, inflammatory, responses to allergens. Which of the following would be considered to be part of nonspecific immunity? A. Plasma cells. B. Macrophages. C. Memory cells. D. CD8 T cells. The answer is B. Macrophages. Macrophages, the main blood cells responsible for phagocytosis of debris, bacteria, and virally infected cells, are part of the nonspecific immune response. While they are able to recognize self versus non-self proteins, they are not uniquely sensitive to any particular non-self protein type. Rather, they phagocytose foreign matter as well as cellular debris. Plasma cells, memory cells, and CD8 T cells are all lymphocytes, and as such they are all part of the adaptive or specific immune system, meaning that they are uniquely sensitive to particular pathogenic proteins. Which of the following antibacterial enzymes is present in saliva? A. Linguolipase. B. Lysozyme. C. Kallikrein. D. Amylase. The answer is B. Lysozyme. While all of the enzymes listed are present in saliva, lysozyme is the only enzyme listed that has antibacterial properties. This enzyme, present not only in saliva but also in tears, sweat, and breast milk, damages bacterial cell walls, making it an important part of the innate immune system. Amylase breaks down carbohydrates, lipase breaks down lipids, and kallikrein breaks down proteins. Which of the following cell counts is particularly diminished in patients with AIDS, and is used to measure disease extent? A. CD8 T cells. B. Platelets. C. CD4 T cells. D. Monocytes. E. Neutrophils. The answer is C. CD4 T cells. In AIDS, which is the most progressed stage of HIV, the cell type that is most significantly diminished is CD4 T cells. Oftentimes, the degree of disease progress of HIV and AIDS is established by monitoring the patient's CD4 T cell count across the course of the illness. The CD4 count guides differential diagnosis when patients with HIV or AIDS present with various complaints, and also guides what prophylactic measures, for example antibiotics, antifungals, are administered to these patients. While CD8 T cell, monocyte, platelet, and neutrophil counts may each be decreased for various reasons in patients with HIV and AIDS, the most substantial association between diminished cell count and HIV/AIDS is that of CD4 T cells. How many lobes total are there in the human lungs? A. 3. B. 5. C. 4. D. 6. The answer is B. 5. There are 5 lobes total in the human lungs. The right lung has 3 lobes, the upper lobe, the middle lobe, and the lower lobe, while the left lung has 2 lobes, the upper lobe and the lower lobe. What is the name for the topmost part of the lung? A. The apex. B. The hilum. C. The lingula. D. The trachea. The answer is A. The apex. The topmost part of the lungs is the apex. This area extends into the neck above the first rib and is the location auscultated for a diagnosis of a Pancoast tumor. The lingula of the lung is a small flap of the lowest part of the upper lobe of the left lung. The hilum is the entry point of the lung for the bronchi, pulmonary artery and vein, and nerves. The trachea is not a part of the lung at all. It is the cartilaginous tube that connects the pharynx and larynx to the lung. Which of the following lists of airway structures is in order from largest to smallest? A. Trachea, bronchiole, bronchi, alveoli. B. Trachea, alveoli, bronchiole, bronchi. C. Trachea, bronchi, bronchiole, alveoli. D. Bronchi, trachea, bronchiole, alveoli. The answer is C. Trachea, bronchi, bronchiole, alveoli. The largest airway structure is the trachea. This branches into 2 smaller bronchi, which enter the left and right lung and bifurcate further into smaller bronchioles. The bronchioles give way into the smallest structures of the lung, the tiny grape-like clusters of alveoli.
What structure of the lung is primarily responsible for controlling volume of airflow during respiration? A. The alveoli. B. The bronchioles. C. The trachea. D. The bronchi. The answer is B. The bronchioles. The main mediator of airflow during respiration is the bronchiole. These tiny airways are wrapped in smooth muscle, which allows them to contract or relax in order to restrict or increase airflow in the lung. The trachea and bronchioles are cartilaginous rather than muscular, and are unable to constrict, while the wall of the alveolar sac is also devoid of smooth muscle, made up only of epithelial cells, capillaries, and connective tissue.